because in California we're getting ready to move out of the lockdown completely. June 15th, old Gavin Newsom is apparently going to just let take it all away. It's all going to go away. I wonder if the vaccination rate is going to truly be close enough to what it needs to be for us to do that, for it to be safe. But, Gavin Newsom's facing a recall election. So that's the reality of politics and public safety and public health is, you threaten a guy with a recall, and all of a sudden, public health takes a back seat to political matters. But Santa Barbara County, where I'm at, we're getting close to the yellow tier, but I mean, we could hit yellow tier, and then the whole dang state's going to reopen. So who knows? This is in the Sun. This is the paper I used to work for. Let's see here. Santa Barbara County nearing the yellow tier in the state's reopening system, reporting some of the lowest COVID-19 metrics the region has seen for the entire pandemic. That's good news, but it won't matter starting on June 15th when the state plans to no longer use the blueprint for a safer economy. This is our county public health director. In order for us to reach the yellow tier, we need to average less than 9 new cases per day, and our case rate needs to be below 2. Our testing positivity has been in the yellow over a month. Over the past few days, we have met the case rate criteria. Okay. According to the community data dashboard, the county's adjusted case rate first dipped in the yellow tier threshold, less than 2% on May 6th at 1.8%. May 16th, rather. This is the metric that historically has held the county back as it progressed through the tier system. We continue to practice precautions to prevent COVID infection. We may get to our first week of credit in the yellow tier as soon as next Tuesday. Do Reynoso, the public health director, said, "Note that we will need 2 weeks in the yellow before we can move to the yellow tier." We only just barely got there with the infection rate, with the case rate. And part of that is the perennial story here as a journalist in northern Santa Barbara County is North County always gets the short end of the stick in services, in attention, in funding. And like we were just seeing, in South County in Santa Barbara, there's piles of money laying around to try to get this, I think it's a great thing to get that land put into, public hands, or to buy it, to keep it from being developed, but at the same time, we have stories like this. North County lags behind South County in vaccination rates, and the county wants to change that. It talks about how there was the South County is hitting all these milestones for vaccinations. Let's see. As the county continues to strive for herd immunity, Public Health Officer Dr. Henning Ansorg commended Cottage, that's the hospital in Santa Barbara, for its role playing in vaccinating the community. Given the site's Goleta location, Cottage Clinic naturally served mostly South County residents. And Ansorg said that North County residents, for a variety of reasons, aren't as likely to use a mass vaccination site to get their shots. North County needs a different approach, and it's evident in the data. The percentages of people who are either partially or fully vaccinated are notably lower in cities like Santa Maria, Lompoc, and Guadalupe compared to South County cities like Santa Barbara and Carpinteria. The county is moving away from mass vaccination and toward mobile clinics to try and meet people where they're at, close the inoculation gap between regions, and get closer to herd immunity to COVID-19. That's interesting. So Santa Barbara County, the county as a whole is on par with the rest of California. 61% of everyone who's eligible to get a vaccine have had at least one dose, according to that health officer. But let's see. But we take a closer look at Santa Barbara County reveals regional disparities. According to California Health and Human Services data, zip codes show that Casmelia, Lompoc, Santa Maria, New Cuyama, Orchid, and Guadalupe, this is all North County, are among the lowest vaccinated in the county, ranging from 41 to 58% of eligible residents having received one or more doses as of May 18th. 70 to 80% of residents in zip codes, that includes parts of Santa Barbara, Montecito, Carpinteria. Okay, so basically, what we have here is a lack of vaccination availability, I believe. When I got my vaccine, because I was in the education tier, I had to go to San Luis Obispo. I had to drive 30 minutes because there was nothing available for weeks in the city, in Santa Maria. Not everybody has the ability to just up and drive 30 minutes on a random day where they probably have work or whatever else. North County also has suffered the majority of infection and the majority of deaths from coronavirus. This is, part to do with our population, the housing density we have here, but also because we have more service work. We have agricultural workers. Some of the first deaths in Santa Maria were farm workers. I did reporting on this. Let me see. Yeah, I did reporting on this. One of the very first deaths in Santa Maria was a farm worker who died alone in a Motel 6. He was here, in the H2A program. This is on my website, politicalpayne.com. Y'all can check that out. I took the photo myself and did all this original reporting. And, it was terrible. His name was Leo Begario Chavez Alvarado. He died alone. He worked for Alco Harvesting, and they have H2A housing. And once they found out that some of their farm workers were infected, they rented out Motel 6 rooms to quarantine them, and that's where he died alone. So Santa Maria Valley, North County, we have been disproportionately affected in our area by coronavirus. So why wouldn't we have the amount of vaccine sites, or why wouldn't we have more availability? That I don't understand. I understand that vaccine hesitancy has been a problem, but I really don't get it. J. Andrew World in the comments says, geez, the city I live in has 0 COVID cases. Wow, good for you. That's interesting. How big's your city, J. Andrew World? Let's see here. I believe I saw a story. I can't remember if it was in the LA Times, but about vaccine hesitancy among some farm workers. Let's see. This is in Cal Matters. Eager to be vaccinated, California farm workers face obstacles. There's that as well. I've done reporting we have an indigenous group called MyCop, Mixteco Indigena, community organizing project. They're trying to get farm workers connected with vaccines and all the other resources, but there are just all these barriers that folks face. About 73% of farm workers said they would get the COVID-19 vaccine as soon as possible, but vaccination clinics at farm work sites are still infrequent and reliant on scarce supply. And this is just part of all the lip service that was given to essential workers at the beginning of the coronavirus pandemic, and how really didn't really mean much. It just meant these are sacrificial workers, that we expect them to just keep going to work in the middle of a crisis that was dangerous for them. And, keep in mind, Democrats and Republicans have supported releasing liability from companies who didn't take the right precautions, and employees and customers if they die from COVID-19. I believe Cuomo did it in New York, and then the Republicans grafted that into their version of one of the COVID-19 bills last year. So there you go. So everybody has this idea of California as, California is blue state. The immigrants get all their handouts, right? No, they don't, and they don't get the help that they need. They don't get the vaccine at farm sites. They're expected to navigate all the online nonsense that they might not. Keep in mind, I've done reporting on this before. A lot of farm workers in Santa Maria Valley, at least, speak indigenous languages. Spanish isn't even their first language, so they have a double language barrier trying to access services, let alone online or paperwork or otherwise, let alone services in a crisis like a coronavirus vaccination. So that's going on here as well. I think it's important to talk about.